Hello, my name is Daniel Leffler. I am from the Division of Gastroenterology at Beth Israel Deaconess Medical Center at Harvard Medical School, and I am just going to take a few minutes to tell you about our study published in this month's issue of Gastroenterology entitled A Randomized Trial of an Alerting System to Improve Adherence to Colonoscopy Follow-Up Recommendations. So, as you all know, electronic medical record systems are becoming increasingly common and increasingly important parts of our medical systems. These have become very good already at helping us track results, follow up on important tests that have done, but there's been very little work done in helping patients adhere to some of the recommendations we give to them. And this is really analogous to the postcards you might get from their dentist's office regarding follow-up for your next cleaning. However, for medical tests, there's actually an additional level beyond just reminding patients to come and do the procedure, and beyond the potential increase in volume that this might cause. It also has potential significant effects on medical legal risk, due to the fact that one of the biggest risks for both primary care physicians and specialists is failure to follow up, failure to encourage follow-up of testing, and delay in diagnosis that may entail. So we decided to try to develop an effective system for addressing deficiencies we found in patient adherence to follow-up recommendations for screening and surveillance colonoscopy. And we based this system on 7 principles that we determined based on meetings from both primary care physicians and specialists. The first is that both primary care physicians and specialists really want to be able to place an order and alter the order depending on the clinical conditions. Primary care physicians also need to be notified before a patient is contacted for scheduling a follow-up procedure to ensure that the procedure is still indicated based on the patient's other comorbidities that may have developed. Patients should really be contacted by letter primarily due to the burden that phone calls place on administrative resources. PCPs should be notified if a patient fails to keep recommended follow-up. However, specialists really don't necessarily need to know if a patient fails to keep follow-up as long as it's documented that an attempt to reach the patient is made, and this should be chosen by the specialist on a case-by-case basis. Importantly, the system should be patient-dependent, not provider-dependent. A lot of systems that exist out there that physicians use themselves fall short when physicians either retire or change systems, change their practices over. So it's really important that a system is patient-dependent so that it stays valid no matter which provider is still taking care of them at the time when the exam comes due. And finally, that the system should be well integrated into the electronic medical record system to go smoothly into workflow and decrease physician burden. So the system that we developed is automated in our electronic medical record system and is ordered at the time that either the first procedure is done or the pathology or the results come back from that first procedure. It then lays dormant until just before the procedure comes due. For colonoscopies, 3 months before the due date for the procedure, the system scans to see if the patient has had an interval procedure or is already scheduled for that colonoscopy. If the patient has been, then nothing is done. But if there's no report of that, then it automatically sends a letter to the primary care physician noting that the patient will soon be due for the procedure. If the primary care physician takes no action, then the patient is then sent a letter stating that they are due for colonoscopy in the near future and that they should call us to schedule it. If a month prior to the procedure still no procedure has been scheduled or completed, a second letter gets sent out in the same fashion. And then finally, if the due date for the procedure passes with no exam completed or scheduled, then the patient is queued up to receive a phone call from an administrator who documents the attempted phone call to reach the patient. In order to test this system, we went back 5 years into our colonoscopy records and found 2,600 patients who had received a colonoscopy 5 years ago for the study period. Of these, 830 were actually eligible for colonoscopies in the study period, and from this we allocated patients at a 2-to-1 basis to either the intervention, which is the set of letters and phone call noted above, or the standard of care, which is really just relying on the patient's memory or primary care physician reminders to schedule their surveillance colonoscopies. And by the conclusion of the study, 45% of patients in the intervention arm compared to only 23% of patients in the control group had scheduled or completed exams. This was highly significant with a p-value of less than 0.0001. It's also important to note that the first letter resulted in approximately 50% of the excess of colonoscopy scheduled, while the second letter, the letter to the PCP and the phone call, resulted in significantly less valuable increases in scheduling and completing exams. Also, although both the letters and the phone call were only done in English, the intervention seemed to be equally effective across ethnicities and primary languages, suggesting that this type of system might be important in reducing healthcare inequalities. We also did some satisfaction surveys after the study, and there were no confidentiality concerns on patients. And in general, patients reported improved satisfaction with our medical center after being involved in this pilot study. So in conclusion, this is really a relatively simple protocol of letters and a phone call, which results in a significant improvement in adherence to colonoscopy surveillance recommendations. And it is also hoped, although our study was not powered to look at it, that this should decrease our medical legal liability. By showing that we've done due diligence, we've tried to contact patients who were due for these exams to the best of our ability in a reasonable way. And as electronic medical record systems become more widespread and more advanced, this type of system, not just for keeping track of tests that have already been done and helping communication for physicians, but really acting as prompts to help patients remember when they're due for specific tests in a way that adds little physician burden, will really be, I believe, important facets of electronic medical record systems in the future. Thank you again for your time.